Good afternoon, folks. This is going to be a look at one last section of the nervous system that has come up repeatedly in our discussions, but one that we need to pay a little bit of special attention to, and that is going to be the cranial nerves. They've come up repeatedly in the course of some of our other conversations, particularly if you did your lesson on the autonomic nervous system, of which they were an important part, and they're going to come up a lot in A&P too as well. So you need to know something about the cranial nerves because they're very medically important. A lot of things can go wrong with them that are relevant to the mediation of your special senses, mediation of things that happen with the movements of your head and neck, because that's really what the cranial nerves are all about. So this little lesson here, it's relatively short, is going to be going through the 12 cranial nerves and letting you know how they work and articulating what they are all about for understanding the significance of them medically and how they function. Now, cranial nerves, you've got two kinds of nerves in the body. You've got cranial nerves, you've got spinal nerves. Cranial nerves are going to be any nerves that, rather than branching off from the spinal cord, branch off from the brain itself. Now, humans, like all mammals, this is a universal feature of mammals, have 12 pairs of cranial nerves. They are numbered in order from 1 to 12, starting from the front of the brain, the most rostral, and counting towards the back of the brain, the most caudal of the cranial nerves. When you're numbering cranial nerves, you number them using Roman numerals, not the standard numbers we use in day-to-day life, but the Roman numerals, like the I, the II, the III, the IV, and so forth. If you don't know how Roman numerals work, my other class did not know how Roman numerals work. I'm going to post a handout on the Blackboard site describing how Roman numerals work. So if you're not familiar with that numbering system using the I's and the V's and the X's and so forth for numbers, look over that handout. You need to know how Roman numerals work, not only to understand cranial nerves, but also because it's kind of an important skill. Could come up in a few other contexts in your life. So I'll post that handout to go along with this lesson. But there are 12 pairs of cranial nerves. The rostral most, closest to the front of the brain, is cranial nerve 1, symbolized with Roman numeral 1 or I. The backmost cranial nerve, the furthest back from the front of the brain, attached to the brainstem, is cranial nerve 12, symbolized with the Roman numeral for 12, XII. They're paired nerves, so you have a left and a right of each cranial nerve. So total of 24 cranial nerves, really, but you've got two copies of each one. Each pair of cranial nerves has a unique name. Each pair of cranial nerves originates from the brain, exits the skull through a very specific opening, and innervates, that is, provides the nerve supply to a very specific structure or structures in the head or neck. That's the thing about the cranial nerves. So with only one exception, they all go to structures related to the head or neck. And they're all involved in the special senses or in the movements of things involving the head or neck. Again, there's one cranial nerve that's an exception to that. So these are all unique and particularly special nerves in that regard. Now I'm going to put a list of the cranial nerves up here on the screen for you, and you have a handout on Blackboard that lists the cranial nerves. That handout is simply, it's in the handouts and lecture notes folder on Blackboard, and that handout is called simply cranial nerves. And actually, I don't have a nice, easy list for you, but I will read them off for you. But you can go to that handout, and you should have that handout handy for this discussion. And the cranial nerves in the order in which they come, and you can follow along with the handout. Actually, I'll just pull that up and we can read through it together here. Okay, but yeah, here's our cranial nerve handout, and the cranial nerves in the order in which they come are the olfactory nerve, the optic nerve, the oculomotor nerve, the trochlear nerve, the trigeminal nerve, the abducens nerve, the facial nerve, the vestibulocochlear nerve, the glossopharyngeal nerve, the vagus nerve, the accessory nerve, and the hypoglossal nerve. Some of those sound like wacky names. I will explain the meaning of all those names as we go along. And you see with each of them that they have, a Roman numeral that is the number by which they are known. It is important as you're learning cranial nerves that you know not only the name of each cranial nerve, but you know the number that goes with it. That is medically important because in medicine, it is extremely common to refer to a cranial nerve by its number. So it is not at all unusual in medical practice for a physician to say the patient has a problem with cranial nerve 7 and not refer to it by name, but to refer to it by number. And it is also very common in medical charting to refer to the cranial nerve just by writing its number down. And when they do that, they will not write the Arabic numeral form of the number. They will write the Roman numeral form of the number. They will write VII for 7, not the number 7 that you're accustomed to in day-to-day life. So it is very important when you're learning cranial nerves that you learn the name of each cranial nerve and that you learn the Roman numeral number that goes with each one. Because in real world medicine, they will be referred to by number and by Roman numeral. So you got to know this. If you want to learn the order of them, there are lots of ways to remember the order in which they come. I've given you an example of a little rhyme to help remember the order in which they come by name. The rhyme I was taught when I was in school was, "On old Olympus's towering top, a friendly Viking grows vines and hops," for like the first letter of the name of each of them, on old Olympus's for olfactory, optic, oculomotor, etc. There are other rhymes available online, that for the first letters of each one to come up with a mnemonic. There are dirty ones available if that helps you, or make up your own, whatever. Also, you will note that for each cranial nerve, I have listed for each cranial nerve, whether it is a sensory nerve only, that it only carries sensory data towards the brain, if it is a motor nerve only, if it only carries motor signals away from the brain, or if it is both, if it carries both sensory and motor data. And so I've listed for each cranial nerve whether it's sensory only, motor only, or both sensory and motor. And then there are some little rhymes and mnemonics and things to remember, whether the order of the cranial nerves is sensory only, motor only, or both. The one I was taught when I was in school to remember if it's sensory, motor, or both for the cranial nerves in the order in which they come was with S for sensory, M for motor, or B for both, is "Some say marry money, but my brother says bad business marrying money." That was the one I was taught. If it helps you, use it. If it doesn't help you, come up with your own trick to remember it. Anyhow, though, what I want to do right now is walk you through all 12 cranial nerves one by one, tell you a little bit about them, and some things you need to know about. Okay. Now, in this handout I've prepared for you for easy reference, I've listed each cranial nerve by name and by Roman numeral. I have listed for you whether it's sensory only, motor only, or both. And I've listed some basic information about it. Here's the kinds of information I've listed. First off, I've listed the opening through which that cranial nerve exits the cranium. Whenever you were learning about the cranium earlier this semester, you learned that it has lots of openings in it, lots of little slits and fissures and foramina, lots of little holes and openings. Many of those are to allow the cranial nerves in and out. For each cranial nerve, I've listed its distribution. The distribution is where that nerve is going, what structure or structures it is innervating. Whenever a nerve innervates something, that is, in other words, what structure is it providing the nerve supply to, the sensation or the motor supply to. And finally, I've listed the major function or functions of that nerve. So as I walk you through these nerves, I'm not going to worry too much about cranial openings right now. You can reference that on here if you are interested. What I care about at the moment as we go through them is I'm going to be talking to you about mostly where they're going and what they're doing. So let's take a look at some cranial nerves. All right, so we'll begin with cranial nerve 1, the olfactory nerve. Strictly a sensory nerve. Name alone tells you something important about it. Now, the olfactory nerve, sensory only, as you can probably gather, its chief function is related to the sense of smell. Its distribution is to the olfactory mucosa, splits into lots and lots and lots of little branches as it passes through the cribriform plate of the ethmoid bone, out of the cranial cavity and into the nasal cavity. Its function is to distribute olfactory data from the olfactory mucosa up to the brain. Should the olfactory nerve get damaged, that can result in the phenomenon of anosmia, that is partial or complete loss of the sense of smell. Now, continuing, we go to the optic nerve. Optic nerve is distributed to the retina, the membrane at the back of the eyeball, which is the actual organ of the sense of vision. Transmits visual data from the retina back into the brain, to the optic chiasm of the brain, which is the structure which then routes visual data to the occipital lobe. Now, a special feature of the optic nerve is the optic nerve, although we call it a cranial nerve and sensory-only structure, is technically not actually a nerve. If you want to be technical, the optic nerve is a tract of white matter. It's a band of white matter extending forward from the rest of the brain into the back of the eyeball. And so if you want to be absolutely technical, it's part of the brain, not a nerve. And when your eye doctor is looking at your eye, shining that light in and visualizing the optic nerve connecting to the retina, they are literally looking at the forwardmost portion of your brain, which I think is pretty nifty. Now, those first two, those are going to be sensory only. The next four cranial nerves all have something in common. All of them have something to do with the eyeball and the movements of the eyeball. And 3 out of the 4 of them are motor only. Our next one is going to be cranial nerve 3, the oculomotor nerve. Name alone says a lot about it right there. Oculomotor nerve, like most of the next couple, is going to exit the eyeball through a slit in the back of the eye socket called the superior orbital fissure. It's a motor-only nerve that has several branches, which are distributed to most of the muscles around the eyeball. Also has a branch that goes to the ciliary muscle, which supports the lens of the eye, and another branch that goes to the iris, which is the colored portion of the eye. The oculomotor nerve has several functions relating to movements of the eyeball. It's responsible for several different directions of eyeball movement. The ciliary muscle portion of it is responsible for what's called the accommodation of the lens of the eye. That is the ability of the lens of the eye to focus on objects at different distances. It is responsible for constricting the pupil of the eye, the portion of the oculomotor nerve that goes to this iris. The iris of the eye, the colored portion, actually contains a ring of muscle that allows us to constrict the pupil of the eye in response to different light levels in order to control how much light is entering the eye. And one branch of the oculomotor nerve goes to the eyelid to help us control how much we open and close our eyes. So things that can go wrong with the oculomotor nerve, depending on which branch of it is damaged, is you might have trouble moving your eye in one direction or another. You might have trouble opening or closing your eye, Or you might find that your eye is permanently constricted or permanently dilated. Some of you might be fans of the late great singer David Bowie. And if you are, you might know that his eyes, he had two different eyes. That well, they appear to be different colors. What's actually going on with David Bowie is that when he was very young, he had an injury to one of his eyes that resulted in damage to his oculomotor nerve, resulting in one of his pupils being permanently dilated. And that was why his eyes appeared to be different from one. If I didn't say it before, damage to the optic nerve, for fairly obvious reasons, is going to result in impaired vision or possibly blindness. Okay, cranial nerve 4, the trochlear nerve. Strange sounding name. A lot of these have strange sounding names. Oculomotor, oculo for eye, motor for movements. Trochlear nerve comes from the Greek word trochlea, which means pulley. The trochlear nerve is distributed to a muscle near the eyeball called the superior oblique muscle. And the reason it's called the trochlear nerve or the pulley is because it's responsible for angular movement of the eyeball. The ability to make your eyeball move up and look at an angle. Damage to that nerve would impair your ability to do that. And I'm telling you all these things because one of the things you're probably going to learn to do at some point in one of your functional classes is to do cranial nerve tests to look for dysfunction in patients' cranial nerves. Now, next we get to cranial nerve 5, the trigeminal nerve. The word trigeminal means three twins. Tri for three, geminal from Gemini for twins. The trigeminal nerve gets its name because it has three distinct branches. Some of its functions are sensory, and some of its functions are motor. So it's the first cranial nerve that we have that has both sensory and motor functions. First branch of the trigeminal nerve is the ophthalmic branch. Now, the spelling O-P-H-T-H, ophthalmic, like your ophthalmologist, your eye doctor. The ophthalmic branch is distributed to the surface of the eyeball. It has sensory functions. It provides cutaneous sensation to the eyeball. If something touches the surface of the eye, it initiates the blinking reflex to help protect the eye from irritants. Then there is the maxillary branch, whose distribution, as you might guess from the name, is to the maxilla, to the upper jaw. Its functions are also sensory. It provides sensation to the entirety of the maxillary region, the region of the upper jaw, which also includes the upper lip, lateral portions of the nose, the lower eyelid, the conjunctiva, the clear membrane of the eye, the maxillary teeth, that is the teeth of the upper jaw, and the cheeks. Damage to either of those branches will impair sensation to the respective regions. Damage to the ophthalmic branch will make you have difficulty blinking. And finally, the third branch is the mandibular branch, which is distributed to the mandible. Also has a portion of the mandibular branch that goes to the temporomandibular joint, the TMJ, and to the muscles of mastication and swallowing. If you don't know that word, mastication, that's the fancy word for chewing. It's part of an entry on your list of words that make 12-year-olds laugh. And there's a part of the mandibular branch that goes to the tensor tympani, one of the tiny little muscles of the inner ear. Mandibular branch has both sensory and motor functions. It provides cutaneous sensation to the lower jaw, the lower teeth, the lower lip, the oral mucosa, the lining of the mouth, and the TMJ. Also controls the muscles of mastication, contributes to swallowing, and to our ability to dampen sound in the middle ear in response to loud sounds. Damage to the mandibular branch, depending on which portion of it is damaged, could result in impaired sensation to the lower jaw, difficulty chewing or biting, or difficulty adjusting to different sound levels. Now, cranial nerve 6, the abducens nerve. This is the last of our four nerves that impacts the eye. Is also sometimes called the abducent nerve. Abducens ending in S or abducent ending in a T. Either of those is an acceptable spelling. Both are in common usage. Abducens is the one with an S that you're going to see more often. The abducens nerve goes to the lateral rectus muscle of the eye. And if the similarity to the word abduction has caught your attention, you are absolutely correct. Its function is to move the eye muscle, so to move the eyeball laterally. It's what lets you look to the side, like abduction to move away from the body. Now we move on to cranial nerve 7. By the way, if you obviously motor only function, if you damage the abducens nerve, you're going to have a hard time turning your eye to the side. Cranial nerve 7, facial nerve. Busy nerve, sensory and motor functions. Its distribution is to the anterior portion of the tongue. Branches of it also go to the muscles of the face, muscles of the scalp, down into the neck, as well as to the salivary glands and the lacrimal glands, which are the glands associated with the tear ducts in the corners of the eyes. Things the facial nerve does. It provides sensation to the face and scalp. It is responsible for facial expressions. It is responsible for the secretion of tears. It's responsible for salivation. It's responsible for closing of the eyes. It's responsible for gustation, sense of taste, on the anterior 2/3 of the tongue. And it's responsible for movements of the lips, including movements to speak, sucking movements, whistling, puckering up your lips for a kiss, movements of the tongue for licking or speech, a lot of movements of the tongue and lips mediated by the facial nerve. Damage to the facial nerve can result in a slack facial expression, difficulty opening or closing the eyes, impaired taste sensation, dry mouth, dry eyes, impaired speech, impaired movements of the lips for any number of purposes. Now, cranial nerve 8, bit of a mouthful of a name, the vestibulocochlear nerve. But if you've listened to my lesson on the special senses, hopefully that name is not unfamiliar to you, because we talked about it in there for one thing, and you should be able to take it apart. Vestibulocochlear, the vestibule and the cochlea, the two regions of the inner ear. Vestibulocochlear nerve has two branches, the vestibular branch that goes to the vestibule and is responsible for sensory data from your sense of equilibrium. And the cochlear branch that goes to the cochlea and is responsible for sensory data from your sense of hearing. So it mediates those two special senses, the sense of equilibrium, the sense of hearing. Damage to either branch can impair that particular sense. Damage to the vestibular branch can result in senses of dizziness or vertigo. Damage to the cochlear branch can result in Deafness, obviously, partial or complete. Because both of those are vibrational senses, technically, the vestibulocochlear branch, it's been argued that it's technically a motor nerve because it mediates those senses by adjusting hair cells and the tiny muscles of the middle ear. But really, it's a sensory nerve. Now, next up, another mouthful of a name, the glossopharyngeal nerve. But once again, not that much of a name if you take it apart. Glosso for tongue, pharyngeal for pharynx. The glossopharyngeal nerve is both sensory and motor. It goes to the posterior portion of the tongue, the muscles of the pharynx, and to your largest set of salivary glands, which are called the parotid glands, and are located approximately here, just anterior to your ears and above your jaws. Glossopharyngeal nerves are involved in speech for moving the tongue at its base, salivation from the parotid glands. They're involved in swallowing for the muscles involved in the pharynx, and they're involved in gustation, sense of taste for the rear of the tongue. And if you're thinking to yourself, well, hey, aren't a lot of those things that I said other cranial nerves do too? Yes, 100%. Because a lot of these are functions that more than one part of the body are involved with. You've got several parts of the tongue that have a cranial nerve that go to them that are involved in different aspects of speech, different aspects of gustation. Swallowing is complicated. Several different sets of muscles are involved in swallowing, so more than one cranial nerve is involved. You have several sets of salivary glands, so more than one cranial nerve is involved. So yes, you're going to find that several cranial nerves have overlapping functions. Next up, we get to cranial nerve 10, the vagus nerve. Note the spelling of Vegas, V-A-G-U-S. It is not like the city where you go to lose all of your money, V-E-G-A-S. Vagus here, V-A-G-U-S, comes from the Greek root word vagante, like the same root word as vagrants, which means wanderer. The vagus nerve is an interesting nerve. It has both sensory and motor functions. I keep forgetting to say, glossopharyngeal nerve, obviously, if you have impairments with it, similar functions to impairments in the facial nerve. Impaired speech, dry mouth from impaired salivation, difficulty swallowing, reduced sense of taste. Vagus nerve, sensory and motor functions. It has the widest distribution of any cranial nerve because the vagus nerve is the only cranial nerve that has distribution below the neck. Branches of the vagus nerve spread out down below the neck and throughout the trunk of the body. It has several different branches known as the vagal trunks. You might remember that term from our lesson on the autonomic nervous system. Branches of the vagus nerve go to the pharyngeal muscles, the epiglottis, the muscles of the GI tract, the muscles around the lungs, the various gastrointestinal glands, and to the muscles of the heart. The vagus nerve is the chief nerve for mediating the actions of the autonomic nervous system in the trunk of the body. It has a lot of different activities. You heard about some of them in our lesson on the autonomic nervous system. Some of the things the vagus nerve is responsible for include, first off, sensory functions in the throats. It provides taste sensation and tactile sensation in the pharynx and the epiglottis. It's involved in voice production. It mediates several reflex actions involving the throats and the esophagus, including swallowing, gagging, and coughing. It handles smooth muscle action around the GI tract, propelling food through the gastrointestinal tract. It handles gastrointestinal secretions, the release of gastric juices and mucus to help with the digestion of food. It handles many of the muscles involved in breathing. And the branches of it that go to the heart are involved in slowing down the heart rates. Fun fact, your heart under normal circumstances goes faster than it needs to. The vagus nerve slows it down by about 25% under normal circumstances. So very busy nerve doing a lot of very important autonomic activities. Damage to any of the vagal trunks or any of the branches of the vagus nerve can have a very wide range of effects on the body, causing things like racing pulse, gastroparesis, failure to move things through the intestinal tract, poor gastric secretions, difficulty swallowing, difficulty coughing, impaired gag reflex, impaired speech, a lot of different problems depending on what part of the vagus nerve is damaged. This is a good time for me to point out. Damage to cranial nerves is comparatively rare. If you hear of somebody having a problem like this, you hear of somebody having difficulty swallowing, you hear of somebody having problems with digestive mobility, you hear of somebody having dry mouth, your first thought should probably not be, oh, they have a cranial nerve problem. Nerve damage is rare. Nerve damage is bad. Nerve damage is a difficult and severe problem. Odds are pretty good that if they're having problems like that, there's a different reason why. Your first go-to answer should probably not be you have cranial nerve damage. It can be a problem. It's probably not the immediate problem. I'm telling you about things that can happen when you have cranial nerve problems. I am not telling you if your patient has this symptom, it means they have a cranial nerve problem. Just being letting you know these are symptoms that can occur if the cranial nerve is damaged, which is not the same thing as if you have this symptom, it means that cranial nerve is damaged. Those symptoms can happen for a whole host of reasons, most of which are more common than cranial nerve damage. Okay, next up, we have cranial nerve 11, the so-called accessory nerve. Motor functions only, has two distinct branches, the cranial branch and the spinal branch. Cranial branch of the accessory nerve is distributed to the muscles of the pharynx, the larynx or voice box, and the soft palate, which is the squishy bit at the back of your mouth. If you run your tongue along the roof of your mouth, you'll feel the bony part, the hard palate, and then if you keep on going, you'll eventually feel the squishy part. That's the soft palate. The cranial branch of the accessory nerve is almost exclusively involved in swallowing. Handles lots of different muscles related to swallowing. Then you have the spinal branch of the soft palate. Spinal branch goes a little bit further down, extends down into the neck, goes to two different muscles, the sternocleidomastoid and the trapezius. Hopefully you remember both of those muscles from our chapter on musculature. If you do not remember their functions, I'll tell you right now. Functions of the spinal branch of the accessory nerve is to mediate movements of the head and neck. Damage to the cranial branch obviously will impose difficulties in swallowing. Damage to the spinal branch can make you have difficulties with certain movements of the head, neck, and shoulders. In particular, you might find you have a hard time lifting your shoulders, and you might find your head tips to one side. And last but not least, the last of our cranial nerves is the hypoglossal nerve. Motor nerve only. It has its own special exit from the cranium. You might remember that on the cranium, there's an opening called the hypoglossal canal. Specific passage just for the hypoglossal nerve. Its distribution is to the muscles of the tongue. Its functions are all related to movements of the tongue, and therefore to assisting with speech and swallowing. Impairments to that nerve will result in problems with speech and swallowing, specifically the aspects of swallowing whereby the tongue pushes things into the throat when you're done chewing. The diagnostic test of the hypoglossal nerve, if you're having problems with it, is if you try to stick out your tongue, it will deviate to one side like this. Or like that, depending on which hypoglossal nerve is damaged. Okay, folks, that's the cranial nerves. Thought you should all know about those. I will post for your reference. This handout is already available on Blackboard for your reference. I will also post for your reference a handout on Roman numerals. So if you're not familiar with the Roman numeral system for numbering the cranial nerves or for anything else in life, you will have that handout for your availability. Okay, thank you all. Hope you have a good evening.